My father was basically the biggest influence in me. I mean, he was a physician, and I used to go with him sometimes to the office, sometimes to the hospital. And I remember the way he treated the patients and the way the patients looked at him and respected him and looked up to him. And I really think, that's basically what I wanted to do. Primary care is really the basic part of healthcare. The primary care doctor has the opportunity to really get to know the patient, not only medically, but on a personal level. That's where we get to prevent disease, promote health. And, for whatever reason the patient does get ill, we're able to treat them either in the acute or the chronic setting. A lot of times they have the notion that they need to see a specialist for everything. And I think you need to treat a patient as a whole and then go wherever is needed. Empathy is basic. I think you need to understand the patient's feelings, the patient's concerns, and be able to deal with them. I like to be remembered as somebody that they trust, that they could count on at any time. And that only happens through years of knowing that patient. My philosophy of care is to try to do the best I can for my patients.